Welcome, welcome, welcome back to the Nursing Ministry channel, a platform where we discuss nursing as a ministry and as a profession. For the new viewers, you're welcome. For the returning viewers, as always, I'm grateful. You too are welcome. Now, like I have mentioned, in this platform, we discuss nursing as a ministry and as a profession. And we have been talking about nursing as a profession lately. The student who has decided to join nursing school and they are learning various courses. And currently we are talking about the basic life support. Now, if you feel lost, kindly watch our previous episodes. For the sake of time, I will not review too much about what we have already discussed, but it will give you a better understanding. Because in today's episode, I want us to go right into where we left off in our previous episode. And we were discussing about the chain of survival. And these are components or links or actions that must be done to ensure that the victim of cardiac arrest has the best chance of survival. By this, we looked at the statistics that when somebody has a cardiac arrest, and peradventure they get to the hospital, about 10% of them make it to the point of survival. That statistics is quite poor. And the reason is this, that when the cardiac arrest patient is found or victim is found, they do have people who are well-meaning and they get to call the hospital. The ambulance probably comes and picks them, or they put them in the car and rush them to hospital. But all this while that they are doing this, the patient's condition is getting worse and worse. So by the time the hospital get to intervene and do what they need to do, offer advanced care life support, this patient is far gone. There was delay in something being done, and so they don't make it to the discharge point. So our discussion from last week and this week, hopefully in the next 2 or 3 episodes, we're going to look at what we are going to do in order to increase this chance of survival, so that instead of 10%, we have a higher number, hopefully 100%. Now, in our previous episode, I did introduce the chain of survival, and we also looked at preparation and preparedness, prevention and preparedness. That was the first component, because our chain has 6 components, which are 6 actions, which are 6 links. It's one and the same thing. So the first action that we looked at in the chain of survival was prevention and preparedness. And the second action was activating the emergency response system. The third action was high quality CPR with defibrillation. The fourth action involved advanced response intervention. And then the fifth one was post-cardiac arrest care. And the final one is when this victim recovers. So all these links are the same globally. It is the same thing no matter where you are in the continent, whether in North America, Australia, Africa, Asia, it doesn't matter. It is the same. It is similar in all the continents, that for the victim to have the best chance of survival, these actions, when implemented, that can be realized, that they will truly survive, and they will probably even survive in a much better state than if there was delay because nothing had been done, or done but not done correctly. So I'm going to give you a story, a Bible story, before we jump in, because this is the nursing ministry. There is no difference between nursing and the scriptures. So let's look at 2 Kings chapter 4. And there is a story about the widow's olive oil. Now, in this story, in the Bible, we have a man who was a prophet, and he belonged to a company of prophets. Now, while he was there, he ended up dying, leaving behind a widow and 2 sons. Now, apparently, this prophet had accumulated some debt. So the creditor saw that the person that owed him had died. Let me go and ask the widow, his wife, to pay me back. So when he approached the widow had nothing and could not pay the man. The creditor said, there's nothing like that. I am coming to take your 2 sons to be my slaves until I recover what your husband owed me when he was alive. What did this widow do? She did not go to the company of prophets. She went straight for Prophet Elisha and told Prophet Elisha, you know, my husband loved the Lord. He revered the Lord. He feared the Lord. Unfortunately, he's died and left behind debt, and the creditor is coming for my 2 sons as his slaves. Elisha looked and said, what can I do for you? What do you have in your house? What do you have? And the widow said, I have nothing at all except a small jar of olive oil. Elisha told him, okay, go and borrow jars all around from your neighbors, and then lock the door behind you and your 2 sons. Begin pouring that small jar of oil into the jars, and when it is filled up, put it on one side. Do that for all the jars. So the widow went ahead and did as she was advised or commanded by Elisha. She went and borrowed the jars, came into the house, locked the door behind herself and her 2 sons, and she began pouring the oil. So one son would be bringing her the empty jar. She would pour the oil, and the other son would put it aside. This son would bring the empty jar. She would continue pouring and say, bring me another one, while this other son put the jar of oil on one side. So this went on strategically. And then at some point, she told the son, bring me another jar. And that son was bringing the empty jar, said, there is not another jar. And that is how that small jar of oil stopped flowing. So when this happened, the widow ran back to Elisha and told him, I've done everything you have said. So Elisha said, good, go and sell that oil and pay back your debt to that creditor. And whatever is left, live on it together with your 2 sons. And that is how the widow got her solution. What is the moral of this story? This widow knew that her husband belonged to a company of prophets. Why didn't she run to the company of prophets and tell them, please, I am your servant. My husband was a part of you. He belonged to this company. Please help me pay the creditor. He wants to take the 2 sons. Help your brother. Help your late brother, who was a prophet, and help me pay this debt so that my sons will not go off as slaves. She didn't do that. Another thing, we don't hear that she just prayed and said that my husband feared the Lord. There's no way this good Lord would allow his sons to be taken as slaves. He feared the Lord, so they will not come for my sons. I will believe and I will wait for the creditor. Even if he comes, I know probably he will pardon me of the debt. She didn't do that. Maybe she prayed. Because if this man feared the Lord, he probably brought up his family in the ways of the Lord, that they too feared the Lord. But maybe after praying, she took action and went to the correct place. She went straight to Elisha to get help. Who knows if the creditor would have come in the next day or 2 when she was still beating around trying to figure out. She must have known about Elisha. She must have known something about Elisha, the kind of prophet that he was, how effective he was. So instead of going to a company of prophets, maybe she didn't even know about, how effective they would have been to her and her sons. She went straight where she knew, I know a man of God who could give me a solution to this problem. So she went to the right place. Ladies and gentlemen, This is all about activating the emergency response system. That is our topic today. And that is the second link in our chain of survival. This widow she is a widow, she activated the emergency response system. What was the emergency response system in this case? Elisha. She had already known about him, probably seen him perform other miracles, solve other problems, knew he was a prophet with results. So instead of trying what she did not know, this is an emergency. If I delay and this creditor comes, taking my sons with him, maybe if later the solution would have been found, the sons would have probably been traumatized emotionally and all. So instead of waiting for the situation to get to that point, let me go immediately and see the man of God, Elisha, and get a response from there, get a solution from him. That is the emergency, activating the emergency response system early. She did it early. She went to the right place immediately. And sure enough, by the time she gathered the jars, did what she was meant to do, she got the solution, managed to sell the oil, and even paid the creditor. So by the time the creditor came, maybe a day or two later, she had the money to give to him, and the sons did not have to go in his hands. Now, having said that, this being a ministry, please understand that this is the second step to give our victim the best chance of survival. We say this chain of survival depends on whether the patient is in the hospital or outside the hospital, whether it is an adult or it is a pediatric. And with pediatric, we mentioned that it was either an infant or a child. An infant and a child are pediatrics, and then we have the adult. This will determine what we are doing. However, whether it's adult or pediatric, in hospital or out of hospital, it is universal that these actions have to be taken, to be done, to give them the best chance of survival, with slight differences here and there. Let me explain. Having seen our victim, whether it is an adult or a pediatric, for instance, it is in hospital, how does activating the emergency response system early look like? Starting with in hospital, I did mention in our previous episodes, there are systems. Some hospitals, the system is more developed than others which do not have that capacity. So looking at the developed systems, I'll give an example. In the settings where I have worked, there are two scenarios. One in one setting, and in my next employment, they had a different system of response in activating emergency response system. So in one of them, inside the rooms or in the ward or the nurse station, there was a bell. It was a circular bell. Some had square shaped. Now this bell, when you press it, and in some when you pull it, you are sending an alarm. The alarm would go to the nurse station. It would go to the ICU. It would go to the emergency department in the critical care units. Why this setting? Why not the other wards? Because in this setting, they had the doctors, the nurses, the respiratory therapists who are handling critical patients. You know the kind of patients in ICU. You know the kind of patients in critical care units, those in emergency department. So they have to have advanced cardiac life support training. They now know how to do those advanced care, like putting a tube down the airway to get to the lungs, how to get the veins quickly. They have been trained more to do this. So the doctors are there, they are on standby, they are working with the other patients. But in case of an emergency in the wards, anywhere else, in the corridors, anywhere, in the facility, even the parking lot of the hospital, the signal would go to those units. Now, it does not mean that the nurses do not have to know the basic life support. Remember, all the healthcare personnel are trained in basic life support. Sometimes even including the cleaners and all, they would attend these classes because a victim may be, the first responder to a victim could be anyone. including you, whom I am giving this information. But now we are on the outside the setting of the hospital. But inside the setting, almost everyone is trained to do basic life support. What do you do when you're the first responder? So these buttons are in the rooms and sometimes in the corridors. And if the setting did not have the rooms, maybe it was a ward that was like a hallway or a hall, then the beds are one after the other. So there would be probably one button on this side of the wall, another button on the other side, but somewhere where it can be accessed easily, or at the nurse's station in the ward itself. So in case of the emergency, and to activate this emergency, the first responder presses that button, but they just don't do it. Remember, they have to access, is this patient responding? Do they have a pulse? If it is a pediatric, remember the infants, we are checking the brachial pulse. Do they have it? And are they breathing? And if the breathing seems to be there, is it normal breathing or are they gasps? And I described that. So if these three are absent, then this is a cardiac arrest. We need to start doing a CPR and offer a high quality CPR. However, if you are the only person and you start CPR, you have not alerted anyone, what would happen? What if you get tired after 2 minutes? Because it is not simply just pressing. You are doing high quality CPR. There is a chance after 2 to 3 minutes you get tired. So that means you'd have to stop, now start looking for help. But that time you are stopping counts. Remember I said that every time the heart is pumped, blood goes up the two arteries to the brain. So the brain requires frequent blood supply. The moment you stop, you are buying time. Seconds are going, minutes are going. And by this, your victim's brain is being injured to the point where it could even be irreversible. So you do not want to stop. You want to continue doing it until advanced care support comes in. However, that is the reason why I keep mentioning the word early. The moment you see the victim, you're supposed to activate, call for help immediately before you start your CPR. Now, this could involve, if the system is not developed, shouting. But in this case, if it is developed like the one that I had experienced, you press the button. The moment you've pressed the button, start your high quality CPR. By this, you have activated the emergency system early. However, if it was somewhere where you are near somebody else that can do it, you start the CPR and simply instruct them to activate that button. You have still fulfilled that second step of the chain of survival. The important thing is notifying the appropriate persons that you need help. So whether you do it personally, pressing the button, or you notify somebody else to do it, you have already called for help. That means the sooner you do it, the sooner the next help will come. So this other person that you have told, even if it is inside the setting, you are the nurse, you have found somebody. Then there's another nurse passing, or there's another, maybe even a cleaner, but they know. You tell them, press that button on the wall. So hopefully the system there has ensured that everyone has learned basic life support, including CPR. So that when you tell them to press, they know that this is a cardiac arrest and CPR needs to be done. So important thing, you either do it yourself, pressing the button, or you notify somebody, press the button, we have a cardiac arrest. Now, when that is done, what happens? In this system, once the signal has gone to the nurse's station, has gone to the emergency department, the ICU, or the critical care unit, the appropriate locations, in those areas, they had a rota. They knew that today, or in this shift, the responders to any cardiac arrest was Dr. So-and-so, nurse so-and-so, a respiratory therapist so and so, or pharmacist and pharmacist so and so. They had a team. So every shift, they knew who were the responders for the shift. So when you go to the shift, that was the first thing that you check, who are the responders to the emergency, and then check the emergency cart. The emergency cart, C-A-R-T, it had everything needed for any emergency response. Talk of the needles, different sizes of the needles, different sizes of the syringes. It had a bag. The bag, we call it a BVM, bag valve mask. It has a bag that when you press, it gives air. So remember CPR, we said you're compressing the heart while you're giving air. Or in any other situation that the victim needs air, so not just for CPR, but it has that bag valve mask of different sizes for infants, for children, for adults. It's all in this cart. It has fluid bags, 500 milliliters, 1 liter of fluid, in case it is needed by the victim that they're responding to. So this cart had everything, including, remember the AED, but in this case, it has the defibrillator. Now, defibrillator is just like an AED, only that it is more advanced, and it is used by healthcare personnel who understand the heart rhythm. It is more complex. So AED that I talked about in our previous episode is used by you and I outside, who do not understand really medical terms, the heart rhythms, to make it just easy for you to use. But the defibrillator does the same thing. It shocks the heart, but it is more advanced. So when it is applied, the medical personnel can tell what is happening on the heart, that there is a problem on this part of the heart, and this is the rhythm of the heart. Yes, you can analyze and shock, it is more advanced. So it is included in this cart. So everything required, including medications for resuscitation of the patient. So it's all included in the cart. Normal color of the cart is red. That is just the basic color. I don't know if other facilities have in different colors. But when you see that red cart, you know this is the emergency cart. So when the team comes in their shift, they need to know who are the responders for any kind of emergency in the facility. Or they have, maybe the system says you are the responders to ward 1, 2, 3, and 4. So anytime there'll be a call from the wards that the buttons have been pressed, there's an activation, then they know that the team that was to respond to these wards are so and so. Whatever they're doing, they immediately stop and rush to that place, to the location where there is a cardiac arrest. Now, the nurse or the healthcare personnel that have found the cardiac arrest in the ward, or if it was in the hallway, remember our story about the person mopping that they have found and activated, they start CPR immediately. As long as they have activated, they start working on the patient, performing compressions, giving breaths, they do what they need to do. Why? Now help is on the way because they have already activated the emergency response system. Help is coming. So by the time they're even getting tired, the help that they have called has arrived to take over so they can also rest or give breaths because it is less taxing, and then now allow the next team to perform more advanced care. Now, once they get that signal, they stop what they're doing, they grab that cart and start running down the hallway to where the location states. So that button or that system probably indicated St. Thomas Ward, room 144. So they already know they're running towards St. Thomas Ward, room 144, where the nurses, the people there are already performing CPR. Or they're running near the radiology department on the hallway, that is where the patient is, to perform this CPR. They're already performing CPR there. So that system has already indicated where the location is. They just need to grab the cart, and 5 of them, 6 of them, 4 of them, they are running towards the patient or the victim with that emergency cart. Now, in the location where I was, of course, they're running not on the staircase, but they're using the ramps to get to the place where the victim is. At that time, when you hear that cat coming, we in the facilities, it sounded like a tremor, you know. So when you hear that, you pin yourself on the wall to give this team access to be able to pass, because we know there's an emergency. The moment you hear the tremor, you don't even want to know, are they coming from this direction or this? You simply stand against the wall, or you clear out of the way, enter a room, so that they can pass by and rush to the victim, because a life is at stake. That is the experience that we had. Now, for the visitors or the people who are not from the facility, they don't understand what is happening. And in such cases, there would be one or two people who would be knocked over. As they came shouting, clear the way, clear the way. So if you have a patient, maybe they were ignoring, or they simply did not think, why should I clear the way? Or they were simply just ignorant or, confused. They don't know what is happening. Such times they would pass with the patient. So there would be cases, one or two cases, where the visitor or this person on the hallway would be knocked out as the team ran over. So it would be upon the people who are left behind, who would understand, go over, confirm that they're not injured, explain, apologize, sorry, there's a life at stake, they're running to save a life, Of course, they shouted, you heard, but you either ignored or you did not know what was happening. So confirm that there's no injury. However, the rationale was, is it better to have an injury or lose a life? So looking at the lesser evil, you'd rather have an injury and deal with the injury than lose a life. So because the team cannot stop and say, excuse me, please, we're in a hurry, there's no time for that. The moment they've had the signal, the emergency response bell has rung, they've left off, they've done, took the cart, and they're rushing towards where the victim was. So as they shout, clear the way, and the tremors, the other healthcare personnel would try to help the visitors or those who don't understand, pull them aside, tell them to stay aside. But if you'd have a stubborn person or somebody who would not respond, unfortunately, or there's no one nearby to help that person move aside, then they'd be knocked down. But thankfully, there'd never been any injury as per that. But the team was able to move. So that is how it operated. And that is simply the system that I understood at that time that was put in place, just to help you understand the rationale behind those buttons. So if you visit a hospital or a healthcare facility, you can ask, show me how does this button look like? Because you could be the patient, a visitor in the hospital, and you're in the room. And so maybe you're shouting for help, at least even if you're the first one, before the nurses come or what have you, and you've already learned that this is the button, you've taken your patient there, they're in hospital, you could ask, where is this button for cardiac arrest? You know your patient has diabetes, they have high blood cholesterol, they have a high blood pressure. It does not ask. Remember, preparation is good. Remember, prevention is good. So having even just understanding, you look around and you see a button, you could ask nurse, what is this button for? And they may say this is for calling for cardiac arrest, because you normally give orientation of the room. When the patient comes, this is your call button, these are the lights to the wall, this is where your washroom is. If you need to raise the head of your bed, this is what you can do. So why not also know about the button on the wall for cardiac arrest? You may be the first responder, so before you even shout for help, you simply press on the button. Guess what? You have done what the nurses could have done, because the nurses will come to do CPR. But you have called early. You've called the team even earlier, because when they come in, they will still press that button to call for help. So why not be the one to to press that button as a visitor, or even, as a visitor or as the family member to this patient. So don't be afraid to ask. Look around. Ask, where's your cardiac arrest button? Your patient has a history of cardiac arrest. They recovered. Now they're in hospital, maybe for something else or something cardiac related. Ask, where is your emergency button? They may bring you out of the room and say, we don't have one in the room, but take you where it is and show you this is it. So you just have an idea. It could be that you are the first responder, you go smash on that button, it sends the signal to the appropriate places, and they come rushing down to help. But the moment you do that, then the CPR starts. In hospital, of course, you let the nurses do it, you let the other people, because there are many, they are well trained, they can do it. However, while you're waiting for the nurse maybe to show up, depending on how the hospital is, you could start. At least you've already smashed the button, you've called for help, you know help is coming, go ahead and start compressing. Let blood start rushing to the vital organ, the brain, to avoid injury. And by that, you would have been a strong link on this chain. Remember, the weakest link. You don't want this link, this component, this element of the chain to be weak, that by the time you're saying, despite the fact you were in hospital, there was delay in calling for help, in shouting for help, you were the first responder, you started CPR before even notifying anyone. Please don't. Make sure you press the button, make sure you call for help. Now, another example, this is the second part of that I had worked under, was using activation codes. And by this was simply color codes. So they'd use colors to send out signal of what kind of emergency we were dealing with. So there would be a color code, purple, pink, black, blue, white, red, yellow, and each of those colors had meanings. Now, the reason why I somehow liked this code is because not relatively to the button. Of course, they're both sending help, the emergency help response that is required. But I liked it because, one, it also ensured privacy and confidentiality. Two, because it allayed any kind of anxiety or fear or confusion. Now, what this system did was this. If there was an emergency, you'd hear in the overhead speaker, and they would be announcing, Code Blue, St. Thomas Ward, room 144. Code Blue, St. Thomas Ward, room 144. Now, when they say Code Blue, St. Thomas Ward, room 144, and they are repeating, we who are in the facility know what Code Blue means. Cardiac or respiratory arrest. The heart or the lungs have arrested. And the moment that happens, the teams in the emergency department, the ICU that are responsible for advanced care will rush there. But that has also signaled the nurses in the ward to start their CPR. So the moment the victim is found, they simply send an alert to the right place, and they would go ahead and announce Code Blue, St. Thomas Ward, room 144. So the people in the facility know there's a cardiac arrest in St. Thomas Ward, room 144. So when we hear that code, if we are the nurses in the ward, we do not assume that, well, in this shift, it is nurse X, nurse Y, and nurse Z that are responding to a cardiac arrest, so I will continue with my work. No. If what you are doing is not an emergency, because you cannot leave one emergency to run to another. Remember justice, equality, fairness. What you do to one, you do to the other. So you cannot leave this one in a critical state to go and save another. So if the nurse is handling a situation that is not an emergency, they immediately leave it. Of course, explain to the patient, kindly, let me rush to an emergency. I'll be right back. And leave them in a safe position. Then rush to where the code is being announced. Because you may assume somebody else has responded, and yet no one has started CPR. The system has been activated. Maybe no one has started, or the person who has started is getting tired. So you need to rush there, ensure that enough team is there. If you find enough people have gathered, then we go back to what we were doing. However, we would join in, if it was not an emergency, we'd join in to help until the advanced care support arrives. Then we could continue with what we are doing, leaving enough people handling the situation. Now, when they say code blue, like I've mentioned, that was cardiac arrest or respiratory failure. It is an emergency that requires the team from the ICU, emergency department and all to respond to it. So that is activating, one way of activating, notifying the overhead central system to announce. Then, secondly, there was code pink. If a baby less than 1 year is either lost, confirmed lost, or suspiciously lost. So anyone below 1 year that is missing, it is just a suspicion because maybe no one has stolen the baby. Maybe another nurse has taken them and is doing something, but they can't find them, such, or they've been moved, or a parent came and took without notifying, and they're in the room in the patient instead of the baby being in the nursery. So when it is suspicious, or it is confirmed for sure, this baby below 1 year cannot be found, they activate that system immediately. Code pink. Code pink, St. Thomas ward, code pink, St. Thomas ward. Sometimes they say the room 44, code pink. So we know that this baby that is lost belongs to room 44, but they are missing. They've checked the washrooms, they're checking everywhere. They've checked the nursery, they're checking the rooms. This baby is not there. And no visitor from the family is around to say that they probably took the baby there in the balcony. They've checked around. So instead of waiting any longer and keep checking and checking and checking, that is the activation of the emergency response. So that sometimes they shut the doors immediately to the facility so that no one leaves. The exit at the gate, they're told no one should leave, or check the cars. It is code pink, so they're checking out for a baby below 1 year. Check the trunks of the car, the back seats, under the seats, open the suitcases. The baby could be hidden in the suitcase. So that is a code that has been activated. A baby less than 1 year is missing. So when they search and the baby is found, then the activation system goes ahead, comes back again. Code pink, clear. Code pink, clear. Code pink, St. Thomas ward, clear. So now we know that the baby that was lost has been found. Whether found that the person that had stolen the baby has been caught, or found that, somebody had taken the baby and they were somewhere that they had not checked well. Because you don't want to keep checking. Time is going, and this person that has stolen or where the baby is, it could be an emergency for sure that this baby has truly gone missing. So you don't want to take that chance. You might as well announce, even though it's a suspicion, then be safe than sorry. So they come and clear the code pink, all clear, code pink, all clear. So it is announced in the system. And then everything, the doors are opened again, everything goes back to normal. I've given you an idea. So you say, what if the baby is above 1 year? Does it mean there's no code? No. For the baby above 1 year or a child above 1 year, they use code purple. Code purple, St. Thomas ward, code purple. You know this, you're looking out for somebody less than 1 year. So anyone that is in the gray area, of course, you arrest and then confirm that it is not the one. So you don't assume, no, this one looks like they're above, this one is below, they can pass. No. Until it is confirmed that the code is clear, everyone around that age bracket, code purple, somebody older, maybe to pediatric, they are missing. They could have ran away. Teenager could have just ran away out of the facility. They don't want to be in hospital. They keep telling the parent, I am well, you people keep keeping me here. And maybe there's something they're rushing to that they had really wanted to attend. So it doesn't mean they've been abducted or kidnapped. It could have meant they have run away, or the parent has run away with them. So all sorts of scenarios could lead to them being confirmed or suspicious to be missing. So the code is activated. Code black, there is a shooter in the facility or there is a bomb. So there is a drill on what we do in cases of code black. So I've gone to this extent to help you understand. When you go to a facility, you hear code blue, room so-and-so. That means there's a cardiac arrest. You hear another code, there's another emergency, and on and on and on. Or the system could involve pressing the button, it sends a signal, and the team arrives. In both cases, the advanced team has to respond because they have to come and ensure that the patient Maybe the BLS, the cardiac CPR has started, but they're coming in to do even more. If they do this, they compress and nothing is happening, remember they have the defibrillator that can detect what exactly is going on in the heart and what they need to do. Oh, this one requires this medication. So they come in, we'll discuss what they do in our next link. That will be our next topic. But they come to do more than just chest compression and airway, chest compression and airway. That is in hospital. Now, out of hospital, how do you act? Sorry, if it is in hospital, let me be fair. Not all facilities have this. Now, there are some facilities, they don't have the button. They don't have that advanced system. They don't have an overhead system that can announce code blue, code blue, code blue. So what do? Remember, this chain of survival is global. No matter the facility where you are, there has to be a system, an emergency response system. The widow in the Bible, did she have a telephone? No. Did she have a button to press? No. Was there an overhead speaker that she could announce to Elisha, the creditor is coming? No. She rushed there, probably took a horse or a donkey and got there quickly or ran, but she hurried to Elisha. Now, as long as it is an organized advanced system, something that you know is effective, that still works. So if in the system it says we don't have any of this, but in case we have a cardiac arrest or an emergency, what we should do is shout, say this as number 2, our location. Number 3, say what you want or what is happening. Maybe that is what they can work with and it has proved to be effective. So it may look something like, help, I am by the pharmacy. We have a cardiac arrest. Come with a crash cart. That is how they have set their own emergency response. That you shout for help. Number 2, you state where your location is. I am near the pharmacy or near pharmacy 1 because maybe you have 5 pharmacies in the hospital. Or I am near the radiology unit. Or I am on the corridor by the emergency department. So you shout, help, and then state your location, and then say what is happening. We have a cardiac arrest. Because all this saves time. When you say this, the people who are coming to help will not have to come, realize, oh, it is bleeding. Then they run back again to come with what is required to arrest the bleeding. No. The moment they hear cardiac arrest, they know what they're coming with. So if the facility has the emergency cart, like I've said, it has even the bandages, the cotton wool, the gauzes, different sizes. So when they're coming with it, they're coming with everything they need for an emergency response. But it is good when you say, help, we have this and this, come with a crash cart. They immediately grab it and come. However, when you're saying help, I have this, come with this, already you're calling the extra help. Help, activate, I am here and here. We have a cardiac arrest. Press the emergency button. You are saying what you want done. So you're saying help, you're mentioning the location, you are stating what you need. Press the emergency button. Activate the emergency response system. By that, maybe you need to now signal for them to announce that there is a code blue. And by the time when they do this, then the advanced care life support comes. You have activated the emergency response system early. And the moment you've done that, swing into action and begin doing CPR. However, in hospital, when you're shouting, and there is no sign that anyone has responded, you may be in the parking lot of the hospital, right at the door, but there's no one around. Please do not start the CPR until you have ensured that somebody has heard you and is doing what you require done. Because you may assume that I'm in the hospital, I have shouted, surely somebody must have heard me. No. There are monitors beeping and bleeping. There are things going on. People are up and about. they probably did not hear you, or you are not audible enough. So during the activation of the emergency response system, you have to ensure that as I have activated, somebody has seen me and they have rushed to do what needs to be done. That is activation of the emergency response system. You confirm that when you have activated, it has been heard, and then you start your high quality CPR. Now, this last part that I have explained is what happens outside the hospital. You shout for help, use a language that can be understood, ensure somebody has heard you before you begin the CPR. And now you may say, what about if the environment or the community I am in, we do not have a system? Remember how we talked about preparedness and prevention? Kindly watch our previous episode. If there is a system, perfect, well prepared, there is a high chance for this victim surviving, because we know that when we hear this is how we respond. Now the chain will flow well. This will not be the weakest link. However, if it's in a community whereby there is no preparedness, there is no system, you know, what do? Shout for help, be audible enough, use a language that can be understood, and then when you call for help, tell the person you're calling, let them know where your location is, similar to what I've explained. Let them know the location. I am by the shop, shop A, shop B. I am by the shop. We have a cardiac arrest. Please call 911 if the 911 in the area responds. Or please call this number, give them the number, or please come, take my phone. As you are doing the CPR, you are able to direct the person on what to do. Because now they have to dial. You will not stand with them as they are dialing. There is somebody that you have already activated. As they're dialing 07 or search for Dr. So-and-so. As you do it, then tell them we have a cardiac arrest. Anything that ensures that the next help comes, the advanced life support comes. It is so unfortunate that none of what I have mentioned is available. There is no Dr. So-and-so. There is no 911. There is no ambulance. There is nothing. What do? Please do not do the CPR alone. Shout for help. Let somebody else come and help you. 1 or 2 people may respond. Let a car come, put the victim in the car, and rush to the hospital where advanced cardiac life support is available, because every second counts. So as you do the CPR, you don't have AED, you don't have anything. Today we have the phone, the mobile phone. But as you call and you're being guided on what to do, you have activated you have activated that emergency response system. You've notified that you need advanced help. They may say, come to the emergency department. We don't have an ambulance. Bring the patient here. Do this and that. You may find somebody helpful. If there's no car, please learn this CPR. Do it yourself. Find a way to get the person inside a car and rush them to the nearest emergency room for more advanced cardiac life support. Simple as that. It is about shouting, calling for help, stating where you are, what you need, what help you need, what is happening. Cardiac life, we have a cardiac arrest. At least the person responding knows this one requires this and that. Let me rush to the side with it. It saves time. So, our episode will end here today. Kindly remember, we have mentioned 2 of the 6 links in our chain, and we do not want any of these links to be the weakest link. That will be said, everything was done well, except that the fact that this was delayed or this was not done to the maximum or effectively, this patient either did not make it after going to hospital, or they made it but they are in a vegetative state, or they made it but now the recovery is taking longer because now they are being trained again on how to walk. You know, their mobility has been impaired. You don't want that. Take what you have learned, know that there is something called activating the emergency response system. So wherever you are in the office, ensure that all employees know what the emergency response system for that setting is. How do you call? The people in the office should know, should we have an emergency? The phone numbers are right here by the phone, or in that box right there, that is where the listing is, or there is a red file right here near the phone. Open it and check here. This is our, as a facility, as an office, this is our emergency response number. And of course, when you call, you already know that the ambulance will come from such a hospital or facility to come and rescue the situation. So find out in your office, do you have an emergency response number? If not, be like Noah, go ahead and set up one. Talk as an organization, what should we do in case of an emergency? Whom should we contact? Let the person you're contacting, the facility or the hospital, know that they will be your emergency response. So don't say we will be calling such a hospital, and yet they do not have an agreement with you that when you will call them, they will come. I'm speaking from where the background that we are coming from. In some other nations, it does not matter whether you had mentioned it to them. The moment they get an emergency response, they respond. The police can respond to the emergency, the firefighters can respond, the hospitals can respond. That is their setting. Find out what your setting, what your system is in your community. Talk to the facility. Talk to the ambulances, their private ambulances, their hospitals, their clinics, and agree with them that should we have an emergency and you get a call from us, then we expect you to respond. Then get to an agreement with them in order to save any emergency situation, especially if it is a cardiac arrest, that they will respond and help you with the CPR, transport the patient to the hospital for advanced care or for further care. Now, in the homes, do the same. As a family or a community, find out what is our emergency response system. Let the house help know these numbers. Let the children who are smart nowadays, they know how to operate the smartphones, the gadgets, they have all that understanding. They have even the numbers offhand. They can learn. So they need to know that in case of emergency, this is the number to call. And the hospital knows that they will respond to your facility. The clinic knows the number you're calling. If it is a doctor, they know. So there has to be that that setup in the homes, in the offices, whether it is a factory, whether it is the airports, whether it is an organization, the supermarkets. Every unit of family needs to know what their emergency response system is. Then have the number and do drills. Time and again, even drills cannot be announced. You can't say tomorrow morning we will do a fire alarm drill because you want to know how prepared they are. These things happen without warnings. So once you do, the trainings are done frequently. However, a drill can be a mock that one person can decide that, tomorrow one person will act this way. Let's see what the people in the office will do in response. Will they remember that there is an emergency response system? Will they remember that there is a list of numbers? Will they even remember that it is a certain number that we call and even what to say? So when you do this, then the employees are kept safe wherever the people are. The people in the family are safe. It doesn't matter, even in the village, like I've said, the chain link is global. The people in your homestead, they know that in case one of us, this happens, this is what we should do. We check responsiveness, we check the pulse, we check the breathing. Then one person, we activate the emergency, call this number, they call, this is the help comes, the car comes, we put the patient, we take them to hospital. As we are doing the CPR, at least there will be a higher chance of survival. I will stop here. Kindly remember our widow's oil, the widow with the olive oil, the story and what she did, and what we are discussing today. It is one and the same thing, activating the emergency response system. There are other stories. Abigail did it with Nabal. She was told by the servant, your husband has just abused King David. Abigail did not wait. Immediately she sent, slaughter the sheep, bring the sheep, bring the flour, do this, put things together, put them on the donkeys. I'm going to meet King David. I'm going to meet David. Before he arrives here, she activated the emergency response system early. She did not even go and ask the husband, what is this you're doing? What are you doing? Do you know whom you have abused? Do you know this man's capacity? Do you know he's an anointed man? Haven't you heard of David? Why didn't you ask me? She did not go through all that. The moment she heard, she went and she responded to that emergency immediately. That response saved all the men in her household. The entire household, I don't even know if she had a son or not. The entire household, all the males, David had decided, I'm going to wipe them out. So she saved more than one person. In this case, we're talking about a victim with a cardiac arrest. She saved hundreds of men that could have been slaughtered by David and his men as a response to anger to what the husband had done. So that is just another example. There are many more activation of the emergency response, and it is done early. It is done early. If you do not know my name is Ludia Osita. I thank you for joining me, interacting with us today. God bless you. Take this information and put it to use. Until our next episode, have a beautiful day. Goodbye.